Hi, Dr. Shaban. Let's talk about rhinoplasty. For our African and Somali clients, a major concern is losing their ethnic identity. How do you refine the nose without westernizing it?
You need to look at the nose in three ways. We have this, the bridge of the nose here. Then we have this, the tip of the nose. Then we have what you call the ala. So really, when you come to us for a rhinoplasty, you need to define what you want. Most Caucasians want the part done sharp. Asian and Africans would want this other part, like the ala to reduce, maybe too wide. Maybe this is too bulky, the tip of the nose, we need to reduce it. We need to customize it for you. So we don't go too much to make this prominent, the bridge of the nose prominent. But what we do is to reduce the size and make it more round. So in most African nose, what do? We reduce the size of the ala, this is called the ala, and also reduce the amount of fat here. It become a little bit slim without making it an European nose.
What is the difference between open and closed rhinoplasty, and which do you prefer for faster healing?
Open rhinoplasty, we open up, bring up the tissues, then we look at them directly. Closed rhinoplasty, we don't need to do all that opening, so there's less dissection. If you're going to do a bridge, this one, or you're going to do the in-between the nose, we call this receptor, we can do a closed rhinoplasty. But when you're doing this, you need to do an open because you're reducing things on the outside. I do both closed and open, depending on the case. It's case to case. In closed rhinoplasty, handling the tissues is not too much, so there's not much breathing, so the recovery is faster than the open rhinoplasty.
Can you fix breathing problems like a deviated septum during the same surgery as the cosmetic reshaping?
You should do that actually, because you get one chance to go to that nose. So do everything on that nose. In the nose, we try and correct everything. Most people, we cover septum, we do it at that particular time.
We often see patients with black eyes after a nose job. What is the realistic social downtime before I can go out for dinner?
Anytime you handle the face is rich with blood vessels. Anytime you handle the face, it's like I've given you a blow on the face. We've had a fight. It needs to settle down, and usually it takes 10 to 12 days. Unfortunately, however much you do, the capillaries have to settle down, the small blood vessels have to settle down. What you normally tell people, take it easy for 2 weeks. Then you can have your social life back, because within 10 to 14 days, all that the blackness will have gone and all that. Usually the soreness goes in 72 hours. But realistically, to get your nice whatever, not feeling like you've been fighting somebody, it takes 14 days. I tell them 2 weeks.
Is it true I cannot wear glasses or sunglasses for a while after surgery? How long is that restriction?
As I said about rhinoplasty, it depends on what we have done on you. If we have done something on the bridge here, we'll not allow you to put weight on it. We'll give it time. But this is not very restrictive. We usually do it 7 days. If I did something just on your tip of the nose, you have no restriction. You can put on your glasses, you can put on your sunglasses.